So, good afternoon. Yes, I'm Ian. I'm the Chief Exec at Revive. So, for those of you that I've met, then hello again. And for those of you I haven't met, then hopefully the next little while you'll get an insight as to what's been happening at Revive and what we've got planned for coming up next. So, what I'm going to talk about is what we're aiming to do over the next 3 years. So, there's been a lot of work going on over the last few months in terms of developing Revive's strategy. Now, strategy always sounds a bit like a kind of scary, complicated thing, but all it is we're looking to ascertain what we're trying to get Revive to achieve over the next 3 years. So I'll take you through the process and what we've come up with so far. There will be the opportunities for our service users, yourselves, to continue to be involved in the process. So we're aiming to do a lot of consultation, set up focus groups. We'll continue to survey it in the way that we have been. So the start point for any plan has got to be understanding where we are now. So that's really been a key focus for what we've done over the last few months. So what we've done, you'll remember at the beginning of this year, we reinstated the client experience survey. That's been really important for getting the feedback in terms of your views of the services and support that Revive is providing. It's always really helpful as well in terms of us identifying what we're doing well, what we could do better, and where the gaps are as well. So the feedback we received from that has been absolutely tremendous, been really, really useful. We also did a really nice thing just at Christmas of getting people's views on what you think of Revive. So we encouraged everybody who came into the centre to complete one of these cards about what Revive means to you. So people were putting their notes and their details in the back of that. That's been really useful for us in terms of helping us to shape the values of the organisation, of what we really stand for, what we represent. But again, what we've been doing is just a lot of talking and a lot of listening. We've been talking to our clients just as on a day-to-day basis, finding out what works, what doesn't work, what we could do better. Talking to our staff. I mean, our staff here are fantastic. We've got a massive amount of experience, and getting their understanding and their input into what Revive can do moving forward has been invaluable. But also talking to some of our other key stakeholders, such as the NHS, Greater Glasgow and Clyde, Scottish Government, and other third sector organisations such as the MS Society and the MS Trust. So what this has given us is a huge amount of data, a huge amount of information, and a huge amount of feedback from the people who understand Revive best, and that's you. So what we've done, we're taking this and we're building this into our framework, the strategy that we're going to have between 2023 and 2026. And so why is that important though? Well, what it's going to do is it's going to give us that long-term direction that we need so we can focus on achieving our goals. It gives us that focus on our beneficiaries so we can make sure that everything that we do at Revive here is all about the people who are affected by MS. It gives us the opportunity to communicate internally and externally about who we are and what we do. A key goal that we've got is to raise the profile of Revive for two reasons. Firstly, to make sure that people affected by MS know that we're here and they can access the support and the services they need at any time. But also by raising our profile, it gives us an opportunity for funding. We're a charity. The way that we can continue to operate and to deliver the lifeline services we provide, we can only do that if we raise sufficient funds to be able to do it. So that's the last part there. It will help us to attract funding. So we've taken all of this, and the start point for any strategic process is we need to ascertain three things. We need to ascertain our vision, we need to ascertain our mission, and we need to look at what our values are. So our vision, it's really the destination that we want to reach. It's where we want to get to. It's the goal that we've got that if we do everything properly, that's what we'll achieve. And based on the feedback that we received from all the sources I've spoken about, we've been able to narrow down our vision to this. Our vision is a society where everyone affected by MS feels supported, valued, and empowered to lead fulfilling lives. We're talking about everyone affected by MS because we obviously recognise that it's not just the person living with a condition, but it's the impact that it has on family, friends, and carers as well. And recognising as well, in terms of leading fulfilling lives, that's not about us saying what a fulfilling life is. That's as determined by the people who are affected. So that's the way that we're looking at. That's the destination that we want to get to. In terms of the journey to get there, that's our mission. Our mission is our purpose. It's what we do to get to that end goal. So again, based on the feedback that we've received, Our mission is to be a caring and inclusive community where everyone affected by MS can find physical, emotional, financial, and social support. So that's our purpose. That's what we do here at Revive. It might sound quite simple, but to narrow it down to that, it's taken quite a lot of work and quite a lot of distillation. Because before this, if I was to ask each one of you, what is the purpose of Revive? What do we do here? We'd probably get 25 different answers. So this is what our journey is going to look like as we try to achieve our mission, our vision. Underpinning that is going to be our values. Now, our values are the way that we're going to behave as we're on this journey. It's about our culture. It's about the way that we do things around here. This is going to guide the staff and the team here in terms of how they're going to perform, what they're going to aspire to do every day that they come into work here. We've narrowed it down to 6, and this is primarily based on the feedback that we've received from our service users. Our values are that we are supportive. We'll give you the help and encouragement that you need to meet your challenges. At Revive, we're friendly. We want everyone who comes through our doors to feel at home. We're welcoming, approachable, and always happy to chat. We're dependable. Whenever you need us, we'll be here. You can trust us to provide expert professional support. And we're caring. We care about everyone we work with, and we'll value the person that you are. We're honest. We value honesty and transparency in everything that we do. And we're empowering. We'll help you to develop the confidence and inspiration to take control of your well-being. So that's the way that we're going to do things around here. We do a lot of these things now. This is going to become embedded into everything that Revive does over the next 3 years. So our key themes that have emerged from the consultation that we've done, we'll be focusing on over the next 3 years. There's 4 of them. The first is going to be support. So we will help everyone affected by MS to live as well as possible. And part of that will be making sure that people are aware of how we can support them. Collaboration, we're going to work in partnership with individuals, healthcare professionals, charities, and other key stakeholders to create improved outcomes for people affected by MS. And again, that links very closely to what you were saying, Kirsty. We're working much closer with the NHS and making sure that we work in partnership with them so that the services that we provide are signposted at the point of diagnosis, at the time that somebody needs them, is absolutely vital. Sustainability is going to be a key theme for us as well. We're going to improve our financial, digital, and environmental sustainability. Our financial sustainability is all about funding. I've mentioned fundraising. I'll come back onto it again. We live in a digital environment, so making sure that we're providing all the opportunities digitally for people to access services when they can't physically make it into the centre is an area that we're exploring further. And obviously, like everybody, we want to be much more environmentally sustainable. And finally, we're going to be much more effective in what we do. So we're going to develop a high-performing team, efficient operations, and robust governance practices. That will enable us to achieve our mission much more effectively. So everything that we do over the next 3 years is going to link into one of these themes, and that's what all of our planning is going to be based on. In terms of creating those plans, that's where the people who use our services, the people about whom Revive is all about, are going to help us to shape those. And that's where we'll continue to talk and consult and listen to the ideas, the suggestions, and the feedback that you can give. We're going to be developing focus groups and other groups over the next year, 2 years, 3 years. We'd love anybody to get involved in those. So we'll be publicising the opportunities to help us develop what we do here at Revive so that it meets the needs of everybody. Underpinning all of this, as I mentioned, is going to be fundraising. Fundraising is one of those things that sometimes people like to talk about and sometimes people don't. My background's in fundraising, so I love it. It costs around about £850,000 a year for Revive to continue to providing the lifeline services that we do. Some good news, we found out last week that we have been awarded the grant from NHS Greater Glasgow and Clyde to continue providing MS services for up to the next 4 years. The value of that grant is around about £150,000 a year. But that still means that we've got a lot of money to raise. So we rely on the generosity of our donors and our fundraisers to continue providing the services that we do. So you'll see that we will provide more opportunities for people to get involved. We'll provide more information about the difference that people's support can make, because it's vital that we raise the funds that we need to continue providing those services. I've got no doubt we'll be able to do it. We've got a really good team in place, we've got the structures, and we've got the skills to be able to achieve that. But if you were to ask me what I think our biggest challenge over the next couple of years is going to be, it's going to be about funding. And you'll see this in the news. So many other charities are talking about this. It's a massive issue whilst energy prices are increasing. We're going through cost of living increases. Inflation's at the level that it is. People have got less money to spend. We need to be focusing much more strategically on our fundraising. And that's exactly what we're going to do. So whether it be people doing sponsored silences like Ellie down in reception, who's going to be doing a sponsored silence next Friday. I know. This has got to be seen. Whether it be people taking part in crazy things like firewalks, getting involved in the kilt walk, we will publish the opportunities we'll have for people to get involved and to support the work that we do so that it benefits everybody that we can. A shameless plug, because the next thing coming up, 4th of June, is the ladies' lunch. Tickets are now on sale. It'll be a fantastic afternoon of entertainment. So if you're available and you're willing to come along, then you can find out more about that on our website or our social media channels. So there you go. That's a little snapshot of what we've been doing, what we're going to be doing, how we're going to be doing it, and why we're going to be doing it. What I'm keen to do is we're going to be having these coffee mornings and get-togethers regularly. I'll provide updates as to how we're progressing in terms of those goals that we're setting, let you know what we're achieving, and let you know what new developments, and listening to your feedback as well.